How does systemic racism impact the political ecology of disease? Have you ever wondered how the structures of our society shape health outcomes for different communities? The question of how systemic racism impacts the political ecology of disease is a significant one. To understand this, we first need to look at systemic racism itself. This term refers to the ways in which racial biases are embedded in our institutions, such as healthcare, education, and housing. These biases can lead to significant health disparities among different racial and ethnic groups. Now, let's connect this to the political ecology of disease. This concept examines how social, political, and economic factors influence the spread and impact of diseases. It looks at how our environment and societal structures interact to shape health outcomes. When we consider systemic racism in this context, we can see several key areas of impact. First, access to health care is a major concern. Systemic racism can limit the ability of marginalized communities to receive quality health care. This often results in delayed diagnoses and inadequate treatment, leading to worse health outcomes. For example, diseases that could be treated or prevented may go unmanaged due to these barriers. Next, we must consider environmental health. Communities of color frequently resided in areas with higher levels of pollution. This can lead to increased risks of respiratory diseases and other health issues. The zoning and housing policies that have historically favored certain groups contribute to this unequal exposure. Socioeconomic factors also play a role. Systemic racism often results in economic disparities, such as lower income and education levels. These factors are closely linked to higher rates of disease and poorer health outcomes. When people lack resources, it becomes harder to maintain good health. Additionally, the stress associated with living in a racially biased society can have serious health implications. Chronic stress can lead to conditions like hypertension and diabetes, further compounding health issues in affected communities. Addressing these impacts is essential for creating equitable health outcomes. From a medical anthropology perspective, it is vital to consider how cultural and social factors intersect with systemic racism. Community-based initiatives and advocacy can play a significant role in challenging these issues. In practical terms, tackling systemic racism in the political ecology of disease involves several strategies. Advocating for policy changes that address healthcare access and environmental health disparities is crucial. Supporting community-led health initiatives can also promote equity. Lastly, ensuring that healthcare providers are culturally competent can help better serve diverse populations. By recognizing and addressing the impact of systemic racism, we can work towards a more equitable distribution of health resources and outcomes. Understanding these connections can help us create a healthier society for everyone.